Welcome to the Heal, Thrive, Dream podcast, where trauma survivors become healthy thrivers. Each month, we'll feature a theme in the trauma recovery and empowerment field. To promote your recovery, healing, and learning how to build dreams, here's your host, Karen Robinson, transformational coach and therapist.
Hello, welcome to the Heal, Thrive, Dream podcast. Our guest today is Amanda Laden. Amanda is the founder and CEO of EP145, the leading platform for elevating people's voices in their own health, healthcare treatment, and well-being. Amanda started EP145 to equip people to advocate for their needs, change a system that was not set up to support women and gender non-conforming folks, and to help people to rise, vocalize, and mobilize to change the healthcare system. So welcome, Amanda. Thank you so much for being here today.
Thank you for having me.
My pleasure. So why did we think that you would be a great fit? I have my answer, but I'm going to ask you for the audience. Like, why you, a CEO of a corporation, why would you be a good fit to be on a show that's geared towards trauma survivors?
Well, a lot of times the folks that we deal with are mainly women in the healthcare system that have gone through some type of issue with their health and healthcare and were dismissed by doctors, by medical professionals, by people in their lives, and they're suffering some form of trauma. I know for myself too, with what I went through of being undiagnosed with a disease and then having multiple miscarriages and ultimately having to have a hysterectomy, all of that is a form of trauma that I also had to work through, to navigate, to find healing around. And so, for me, all of this is really important to bring to the mainstream and to talk about, because a lot of us are suffering in silence and we're not talking about some of these issues.
That's right. Yeah. My niche is survivors, and most, if not, I don't want to say all because there's always an exception, but most have had lots of issues with the healthcare system. So I'm sure that doesn't shock you with what you know.
No, unfortunately, yeah. It's a sad state of affairs. Every time I talk to a woman about my story, they come up with a story of their own, whether it's themselves or a family member or a mother, sister, friend. And so, unfortunately, we're still dealing with a lot of issues in the medical system and being dismissed. And, even to the point of, if you look at the death rate in childbirth right now, particularly for women of color, it's shocking. It's appalling what women are having to deal with. And then the trauma that gets forced upon them, their children, if they have them, their spouses, their partners. It's not a great state of affairs right now.
Mm-hmm. Yeah, well, I'm glad there's people like you that are addressing it. Tell me how you address it, though. Like, what's your process? How do you do this?
Yeah, a couple of different ways. So, the medical industrial complex is very, very complicated. There are a lot of layers to it. So the first is really just helping women to advocate themselves, to find their own voices, to find the support they need, whether that's with themselves, whether it's with a family member, whether it's getting a healthcare advocate or health advocate within the system. So that's one way. The other way is just to bring awareness to certain things that women might be dealing with also their right in the medical system sometimes. And then the final way is looking at it from the other side. So helping medical practitioners and people that work within medical industrial complex to come at patients with a human-centric approach and with empathy. And so kind of those three ways, first and foremost, it was just, for me, it was about telling my story, and then also creating a platform where other women could share their stories, where experts could share what's going on, and so that people feel like they have a place to go, which is psychologically safe and also supportive.
What part of your story, like I know you shared a little bit, but is there more to your story that you would like to share with us today? Because it may help someone listening.
Sure. So my story is that I was undiagnosed with a disease for probably 20 years. And my disease is called adenomyosis. It's a cousin of endometriosis. It causes a lot of issues with the female cycle. So anybody who's listening that has really, really bad periods, cramping, debilitating periods, mine were super debilitating. So I couldn't do anything for 2 to 3 days out of every month. So just imagine having to work your life around that. And so there was part of that of just doctors telling me, no, you don't know what you're talking about. You don't know your body. It's just bad periods, just bad periods, just bad periods. Well, fast forward many years, and with my ex-husband, we were trying to get pregnant and went through multiple rounds of IVF. So if anybody has endometriosis, adenomyosis, PCOS, going through all of that, if you're not diagnosed, or even if you are, that makes it worse. That makes the disease worse. So I was still undiagnosed at that time, then ended up having a few miscarriages. And finally, by the time that I was diagnosed, my adenomyosis was diffused, meaning it was everywhere in my uterus, and it was starting to grow into other parts of my organs in my body. And so I ended up being an emergent case where I had to have a hysterectomy, and ultimately, wasn't able to carry a baby to full term and wasn't able to have children. And so, that, and then when I found out, and a couple weeks after my hysterectomy, you go in for a 2-week post-op, and my ex asked the surgeon, why wasn't Amanda ever diagnosed? We had, she had so many MRIs, so many ultrasounds, and it was everywhere. My adenomyosis was everywhere. And the surgeon laughed, and she said it was in their best interest, meaning IVF doctors' best interest, not to diagnose her because you were a money-making machine for them. So that infuriated me. And, because it almost
could have killed you too.
Exactly. Yeah, I mean, by the time my uterus was taken out, my surgeon was concerned that it was going to burst. And yeah, that could have either killed me or led to some other complications. That's how bad it was, and that's how big my uterus was. So, all of that is to say, we need a system where we're listening to women, where we're believing our pain, where we're believing what we're going through. And I just believe if enough of us are using our voices to talk about what we're going through, then we have to force some change. So yeah, that's my story. And I don't know if folks can see me by the time this comes out, but part of me too is I'm an educated white woman, and I was like, what's everybody else experiencing? If I'm experiencing this, what about, underrepresented people, people of color, people who might have some disability? What about them? And so that's how I got into doing some of this work, because I was just like, enough is enough. They almost killed me.
Yeah, it's no secret that women are oppressed in the medical system. And then if you're any kind of minority population above and beyond that, it's a lot worse.
Yeah.
So does your program train providers? Tell us more, what the advocacy looks like.
Yeah, so there are people on my team who are trauma-informed and trauma-informed coaches, trainers, consultants. And so we will go into the medical system and provide some trauma-informed training for those practitioners inside of a hospital, inside of a doctor's office. There's also people on my team that are coaches and consultants that can work one-on-one with certain providers as well. And then we are working on another program right now, which really focuses on being human-centered and having empathy. And so it's coming out later. But yeah, my day job, I actually work in corporate. And so this is my little side gig of
helping, your love passion.
Yeah. To helping to change the system. And people keep asking me too, well, what else are you going to do for women? And I'm like, not sure yet, but watch this space. Maybe by the time this podcast comes out, there's going to be so much more that I don't even know about right now.
Yeah, or maybe at one point you'll leave corporate because it's so successful that you can do that. Is that a goal for you? Or you're not sure?
Yeah. I mean, I own my other business, so I do consultancy in organizations. But yeah, that is the goal. That is the goal, to flip the businesses and to really focus on something where I feel like I'm making a difference.
Yeah. I'm sure this job is going to do it.
It's so hard to navigate. I'm sure I mean, there's so many layers to it. And every day I'm kind of like, well, which problem do I want to tackle? And the stories that I hear from other people, every time I'm talking to somebody else, I learn something new. And I'm just like, my mind is blown most of the time when I'm, hearing from other women and practitioners. And I don't know, something really has to shift. I think, the thing for me that I constantly think about when it comes to our own health and care and when we're in this system is, where's the money going? Follow the money. When I got my bill for my hysterectomy, this was now almost 2 years ago, it was $196,000. And, luckily I had insurance, and insurance covered most of that. But I'm just like, where is that money going? And that wasn't even for the anesthesiologists. I got that bill after. So where is the money going? And, I was also thinking comparatively when I got that bill, I thought, if this were a man's disease, granted, I had they used a robot in my surgery. My surgeon's amazing. There's nothing I could say bad about my surgeon. She's incredible. She's an expert in her space. I thank her for having, my surgery go off without a hitch. But I'm just like, $196,000 for one 3-hour surgery. Where is the money going? I mean, I think we have to look at this. And so I guess back to the question too of like, what do you tackle here that's really going to help people? Because, if this were anybody else, if this were another woman and she didn't have health insurance and she has to have the surgery, I had to have the surgery, mine was life threatening. What do you do if you can't afford to pay that bill?
I don't have answers for you.
Yeah.
I know, like, when I was a new social worker, I had a diabetic client who also had schizophrenia.
Mm.
And I took her to the emergency room because her glucose was out of control. And they didn't want to see her. And I'm like, and she's African American too, had schizophrenia, had diabetes and some other complications. I'm like, you will see her. We're not leaving. Like, and it was all, they didn't want to see her because her Medicaid had a pause. Like every time Medicaid gets recertified, it's not back in the day anyway. This was in the early 90s. It wasn't a smooth transition. There was always a gap in care or time. And sometimes it was a few days, sometimes it was a few weeks. Well, emergencies are on a timetable. And so it was pretty fascinating. But because I was telling them, you will see her. She's having a medical crisis, insurance or not, you will see her. They did. And because she was about ready to turn around and walk away. And I'm like, you could die from this. No, you are going to be seen. And it was really crazy because one of my thoughts was, if I was in her shoes, I'd probably be walking away too, because that's what women do.
Right. And I think about too, I was trying to put myself into somebody else's shoes too, thinking like, if I'm a different woman and didn't have health insurance, then think about the other layer of trauma that's being put onto that person when they get that bill. So not only are you, in my case too, like, your uterus is associated in our society with some form of your identity, and so the thing that's being taken out of me is the thing that people associate with womanhood in our society, with being able to be a mother, with being able to, we've got these boxes we have to tick, particularly, I think, here in America of, you're not woman enough if you weren't able to have children, or why didn't you have a child? So there's all of these things that get put onto our identities.
Judgments,
and then it gets taken away from you. That in and of itself, when a body part comes out, and a major body part with a major surgery, that in and of itself is trauma that, you have to heal from. I worked with a somatic therapist to learn how to get back into my body, going through all the miscarriages, going through IVF, which is, I didn't have a great experience with IVF. The drugs really didn't work for my body. And then, of course, making my disease worse. I lived outside of my body for many years, really, truly, because of the chronic pain, because of like feeling like I was a science experiment, not being heard, being dismissed, and doctors telling me like, you don't know what your body's doing. And so it's all in your head. you hysterical woman. So after my surgery, I was like, how do I get back into this body? How do I get back into my soma? How do I get back into this vessel that is carrying me around this planet? And so I worked with a somatic therapist to heal from some of the trauma of, the miscarriages, of the IVF treatment, of the pain, and all of that, just to be able to feel again and to feel my body.
I'm really glad that you mentioned that, because one of my questions for you is like, how on earth did you go about your healing journey and work and then, start this business? Like what was your recovery path like?
Well, I'm going to go back a few years. I realized things were pretty bad after kind of one of my miscarriages, I would say the big miscarriage, so to speak, because we were in the clear. So meaning I had been transferred over to our midwife. We'd already heard the heartbeat. I was at a point, I was far enough along where, we were told I was going to be able to carry a healthy baby. And then I miscarried, and I went into a very deep state of depression. It was very, because this is for women who have gone through something where you really, really, really want to start a family. You are you're in a place of privilege where you can even afford IVF, and, you're going through those treatments. Mine was no walk in the park. My treatments were awful on my body, and the drugs really also affected my mental state. Going through that, I went through a deep state of depression. Now, luckily, the hospital I was at where I miscarried and had to have my surgeries, they provided a counselor who is trained in difficult childbirth, losing a child, having miscarriages, and you get the option when you're at that hospital to seek counseling for 6 months. I'm not sure everybody takes it. I took it. So that was one of and I think they also offer it outside the insurance system. So meaning, even if you didn't have the right type of insurance, you could see one of their counselors, which I thought was incredible. So that was the first step, is actually talking to a therapist and working through what this actually looked like and trying to figure out how I put one foot in front of the other every single day. Now, my day job, I have to see clients. I'm the breadwinner, the moneymaker of my business. If I'm not seeing clients, I'm not making any money. And there were months where I just couldn't fathom getting out of bed. And so, being able to see a licensed therapist really helped. And then fast forward to finally getting diagnosed and going through my hysterectomy, I then sought help, as I mentioned, with a somatic therapist to learn how to move the trauma actually through my body. And to learn, how do I identify what this is? What is this feeling I'm feeling? I didn't have the language for it. All I knew was, I'm angry. Okay, well, what is that anger and where is it sitting in your body? And so she really helped me to be able, she's amazing. Her name's Ani Anderson. I'm sure she wouldn't mind me mentioning her name because this is the work she does. She's based out on the East Coast in upstate New York. And, she has a wonderful business where she really particularly helps people, not just women, but to start to identify where these things are in their bodies and in their soma. So I did that. I also sought out the help of acupuncturists. They were really helpful for me when I was going through my adenomyosis and managing the pain. So during my cycle, they would help me to be able to stop blood flow a little bit. They can do some things where it's not as heavy, and then they can also do some things where they're helping to calm your nervous system. So that was super helpful. And then, just continued counseling and recognizing now, okay, what am I feeling? I know the anniversary of the date of that final miscarriage. I'm very cognizant of when it is. When that comes up, I really focus on my self-care that day. I don't work, because even though it was years ago now, it's still something, it's still grief. It's still something I'm feeling.
Oh, loss. Yeah.
Mm-hmm.
Yeah. Oh, thank you for sharing all that. You reminded me when you're talking about the soma therapy. When I had it, I was actually working in a hospital, and I would do my therapy sessions it was during COVID, and I would do my therapy during lunch break, and my body kept telling me, why are you working here?
Yeah.
Why? And during one of those sessions is when I decided to leave. It was a good decision. Like the job was literally like eating me up alive, like all the injustices that happened. And yeah, it was an interesting, when you have trauma, then you work in a place where there's more trauma, like if it's oppressed in all these different ways, it's like you can't really heal well, even if you have the access to care. Like if you stay in the environment that's causing, it's like domestic violence. If a woman can't heal from trauma if she's still living in oppression. It just reminded me of that.
It's so true. And I think one of the things, we've kind of also been conditioned to do is not to listen to our intuition, our inner knowing, our gut, whatever you want to call it. And, especially if you're going through some type of trauma or you live in chronic pain or, whatever might be going on in your life, we disassociate. And so being able to, get back into our bodies and allow the healing to happen and being able to tap into that intuition and to our guts again, or, our inner knowing is so, so key, I think, for part of this process.
Absolutely. Have you written out your story? Are you considering writing a book to tell your story?
I am. I mean, it's so interesting around, I think when you go through so many different avenues or aspects of life, it's like, what part of my story is actually relevant? What part of it do people want to hear and know? I share my story on my own podcast. I also, like you do, provide a platform for other women to share their stories so that we can see ourselves in each other and know that there's community and know that we're not alone. I think, actually, I'll come back and answer your question. I think one of the things that, when I was going through all that I was going through, first of all, we weren't telling a lot of people we were going through IVF. And so that in and of itself is like very isolating. And then the second piece is when I miscarried, not a lot of people knew that I was even pregnant. And because we had gone through so much loss. And that also, I was just like, I don't know where the community is. I don't know who to rely upon. I don't know where to go. And, providing space for people to go, oh, there is a safe space for me to talk about this. It's not as taboo. We made some of these things out to be taboo. Whatever you've experienced, we don't talk about these things enough and provide women the opportunity to commune. And so, I think that's really
very
important.
Isolating. Yeah. You feel alone when the truth is there's other women going through the same. Maybe it's a little better or a little worse. Like we can't compare stories, right?
No, I'm so happy
you cope differently.
I'm so happy you bring that up because, again, I think we've been taught to otherize. Or, one of the things that came up when I miscarried, the miscarriage where I ended up having to have some surgeries, is people would say, well, how far along were you? Why does that matter?
How real was this experience for you?
Right.
The heartbeat to me is pretty, and the heartbeat's early.
Yeah.
After heartbeat, I mean, I can't judge it for another woman, but I know in my experiences with pregnancy, that when the heartbeat, like that's a big deal.
Yeah, it's a big deal. And so, I think we can't compare grief. We can't compare just because you were here. Oh, well, and I think that this misnomer of time heals, I disagree. There's different points in time where my grief rears its head. One of those times for me is around Mother's Day. I happen to be born on Mother's Day.
Oh, wow.
Yeah. So part of my story, and when you ask me if I'm writing a book, I think so. I'm just not sure which elements are going to be relevant and what are going to help people. But, my story is I was born on Mother's Day. My mom walked out when I was 2. My disease happened to be in my uterus. I wasn't able to be a mom. Now that is not lost on me in terms of where my disease, where my disease chose to form. So to me also, there's some intergenerational trauma, especially with females in my life, that I think I was probably on this earth to heal. So the reason maybe why I couldn't be a mom is because I needed to stop some intergenerational trauma. And, all of that is not lost on me in terms of me now being this advocate for women and sharing women's stories and maybe changing the narrative around motherhood.
Well, it brings, in my head too, it brings like you're taking your pain and your continuing pain and deciding to make a difference with it, because there's nothing you can do about your losses,
No.
and making meaning and giving back and trying to help other women is pretty powerful and hopefully healing for you. I know it's been healing for me with my own traumas.
Yeah.
Seeing other people heal.
It's interesting. I mean, I think it's amazing to provide this platform. It's also sometimes I don't know when I'm interviewing somebody or when I'm having these conversations, what's going to trigger me. And, just being aware of that, of what brings back up the trauma again, and then how I can, whether it's I need to grieve again, whether I need to cry, whether I need to scream, run, whatever those things are I need to do, just being very cognizant that none of it is wrong. It is what it is right now in this moment, and how can I address it in a way that's the healthiest way for me to address it?
I'm glad you said that, because my way for many years was food, and I'm in that program now working through that. So what are the healthy ways? And if you have unhealthy ways, I think it's okay to say that too, because people identify with that as well. Like if you spend a lot of money when you're sad, I think it's important to, if you feel like you want to share it. So tell us about your healing, the unhealthy and the healthy.
Yeah, I think for the unhealthy things I was doing was like stuffing my emotions down and not allowing myself to experience like the complex emotions that we as human beings face. Like I didn't cry for a long time about it, right? That's pretty unhealthy. I mean, just think about where that gets stuck in your body. And I think there were other things that were coming up and sitting and not being able to address the anger of not being able to be a mom or, going through those miscarriages. So that to me was pretty unhealthy, not actually facing the emotions and feeling like I had to be strong all the time and people couldn't see my breakdown, so to speak, like that to me was probably the unhealthiest thing I was doing. I think the other thing that was pretty unhealthy was not listening to my gut and staying in a marriage where my partner really wasn't supportive when I was going through all of this. And
I did have that question. Yeah.
Yeah. One of the things he said to me when I was in a serious state of depression, and I don't know if it's because he was dealing with his own grief, he couldn't see it. He was used to seeing me strong all the time and getting up and going out there and working. But one of the things he said in like the deep despairs of my depression when I was sitting unable to get out of bed was, when are you going to get out of bed and go back to work? And it's like, do you not see your wife crumbling right in front of your eyes? So that, and for years it was like, he and I went to counseling, and for years it was like, oh, I can get through this. And that was just a moment in time. But I recognized like, oh, this isn't my person. And so finally, actually working with my somatic therapist, it was very interesting because our first session, she asked me a question around, what do you want to get out of this? Fully expecting me to say, oh, I want to move through the trauma of my hysterectomy and the body. And my response was, and I'm going to paraphrase because I don't remember exactly what I said, but my response was, whether or not I'm in the right relationship and to stay in this marriage. And we were both blown away because I didn't expect
it just
that.
Came up.
It just came up. So there's that. And I think that, again, that was one of the healthiest ways. Right now, what I do is I just listen. Like I'm getting into some deep knowing of myself again and to learn, what's important to me. I'm setting some very firm boundaries with people in my life, or just removing people that no longer support me and can't understand this next version of myself that I'm becoming. So, I think there's people in your lives that when you're growing, they're either going to fully support that and go, wow, like I'm witnessing this, I'm watching this, and I think that's beautiful, or they're going to judge and try to tear you down. And so those people, the latter, I'm cutting them out of my life because they're no longer serving my purpose. It's not serving who I'm becoming. And I think what was unhealthy is that I was staying tethered to some of those relationships, and they don't serve me. The other thing I'm doing, which is on the healthier side, is I'm not a runner. I ran when I was like young, in my early 20s. But lately, there's been messages I've been getting, or it's just like, move your feet. You need to go out and move your feet. And so I will go out for I call it a wog, because it's like a walk jog. It's not really a run.
I'm never going to forget you now for that.
It's not really a run. I'm sure people see me or like driving by me like, oh, that poor woman.
I love it.
But I'm trying, when I get those messages, I will move my feet, because I know there's something that I need to work through. And so I will do my best in whatever city I'm in. The other thing that I just did, which was probably one of the best experiences I've allowed myself to do in the past few years, I just took myself on a solo trip for 5 weeks around Europe. And I met up with friends in certain places. I have friends in Portugal. I also have friends in England. But for the most part, I was by myself. And then I had a love affair with a young Greek soldier, which also helped.
Yes.
Which was amazing. And so,
I love that you shared that.
Yeah.
Eat, pray, love right here.
Yeah, exactly. I mean, that, and also when you said, are you writing the book? It's like, I kind of think I'm going to write the book including that. So it is my own journey of like, eat, pray, love, but the love part being him, but also the love part of finding love for myself again.
Love, yeah. Well, that's so fun, that part, that little spiciness there. Love that. Yeah, I think travel is incredibly healing. I went around China for my divorce, and I've done a lot of places alone too. And I just, well, if you have a good travel buddy, like one of my daughters is a great travel buddy. Like since she was 3, she's like, "Where's my passport? Mom, can I have my own ticket?" She's a very independent little woman. Now she's 20. Like, she's a great travel buddy, but it's sometimes when you travel alone, like, you can just do whatever you want and your downtime and how you tour and not tour. It's a great healing journey, especially if you have resources to do a couple of spa activities.
Yeah. I mean,
wonderful.
It was the first time. I'm a planner and I love to plan trips, but it was the first time I really had like no itinerary other than I had to be in certain places at certain times, just because I told friends I'd be in Lisbon. I had to see a client in England, those kinds of things. But, it was the first time where I'd wake up and go, what do I feel like doing today? Oh, I'm just going to walk the city, have a nice lunch with wine, and that'll be my day. It's like,
I love that. I want to be like you when I grow up.
And I'm like, oh, I'm going to write today. One of the healing things for me too is around journaling and writing. And I had cut that off in myself for a very long time. And I love to write. And when I met the young Greek soldier, he switched something. Well, he switched a lot on in me, but he switched something on in me. And I started writing again. And so it felt good. It was like, oh, this feels really good. And not judging myself for, everybody's like, oh, you didn't see this monument or this thing. And I'm like, sure didn't. Well, what did you do in that city? I had great lunches and great wine. I mean,
and that statue is still there if I want to go.
Yeah.
Oh, that's really incredible. I love that. So for anyone listening that's going through, any kind of trauma, including medical trauma, what words of wisdom would you give them, or how would you instill hope in them that even though they might be in a dark place right now, that their future can have joy in it? Like, how do you get that message across?
I would just say, please don't go it alone. And, there are resources out there, whether it's seeking a therapist, a counselor, a friend who is non-judgmental. Please do not go it alone. That is the thing that I think is the most isolating and will put you even further into, a depression or even more trauma that doesn't get healed. And so, whether it is, you need to seek out a community of people, but please find some support or an advocate for you. The other thing I talk about is if you are going through the medical system and, it's very confusing, right? The jargon, the terminology that doctors use, especially if you haven't gone to medical school, or even if you have, and this isn't your area of specialty, it's very confusing. And so find somebody who can go with you to your doctor's appointments, who can take notes for you, that you feel comfortable with, that can ask the questions of the doctors. Also, right now, what doctors get 7 minutes to see a patient. You can demand more time. I wouldn't let my surgeon leave until I would go in with a notebook. I would write out all my questions in advance, and then I would take notes or have my ex-husband take notes. But, don't go it alone and have somebody there with you, because you're especially if you're going through some medical trauma, you're dealing with all these complex decisions, and it's very, very overwhelming. Even if like in my instance, having to decide when I was going to have my hysterectomy, and there was an added complication. I have 2 aneurysms at the base of my brain. And so when you're going through that
surgery, that little thing?
Yeah.
You tell me at the end?
So, when you're going through surgery like that, your head is below your heart, right? So there's additional complications that can happen while you're on the operating table. And long story short, my surgery was canceled the first time around because they didn't read my charts properly. It got canceled the morning of because they didn't see that I had these aneurysms and I needed neuro clearance, and I didn't know that. And then they tried to blame me. And I was like, do not put this on the patient. So, those kinds of things where you're already in a state of anxiety, you're in a state of, oh my gosh, like for my case, oh my God, I'm going to die on the operating table because I'm going to bleed out and stroke out because of my aneurysms. Like what, like you're in a really, at least for me, state of anxiety. And so there were a couple of things I appointed, in my instance, I appointed a friend as my proxy. Not my husband, my ex-husband, because I didn't think he'd be able to make complex decisions for me should life and death decisions need to be made. So a friend was on speed dial. I had an advocate come in. There are things that you can do, and just don't go it alone.
Such great advice. Thank you so much. Well, for anyone that wants to know more about you or contact you, how do you want people to reach out?
Sure. You can go to my website at period2pause.com. It's, period to menopause and everything in between. And it's a double entendre of sometimes we just need a moment to pause. And you can go there. You can contact me at amanda@period2pause.com. And our Instagram and social handles are the same as well.
Thank you so much, Amanda.
Thank you. Thank you for providing this platform for people.
Thank you for listening in today. Please join us next week, same day and time. Also, I would love for you to check out my website, healthrivedream.com.